Right, good evening everybody. Thank you very much for joining us for this evening's webinar, which is being hosted by AHDB Beef and Lamb. My name is Catherine Parrott and I'm the Knowledge Transfer Officer for Beef and Lamb within AHDB. I'm delighted to bring you tonight's webinar on management of the suckler cow and calf around calving. Our presenter this evening is Dr. Alexander Corbishley. Alex has practiced as a farm animal vet and is currently a lecturer in farm animal practice at the University of Edinburgh. So the plan of action for this evening is Alex will take you through a presentation and then there'll be some time for questions at the end. You will all be muted throughout the webinar, but if anyone would like to ask a question or at any time throughout the presentation, if you think of a question, then please just type it into the box on the right-hand side of your screen, and then when Alex is finished presenting, I can ask him those. There's over 170 people registered for the webinar this evening, and I'd just like to thank Elena, who's working behind the scenes to keep everything running as smoothly as possible. If we do encounter any technical difficulties, please bear with us, but hopefully these will be kept to a minimum. So without further delay, I'll hand you over to Alex.
Thank you very much, Catherine. So as Catherine said, I'm one of the vets up here in Edinburgh, and we're going to talk today about the suckler cow and the calf around the time of calving. Hopefully the talk should last around 35-40 minutes, so there should be plenty of time for questions afterwards. So we'll start talking about nutritional management of the cow. We'll then move on to the ease of calving and when to assist, and then move on to the calf after birth, looking at vigour, really focusing on the importance of colostrum, and then thinking a little bit about specific diseases like Scours in the first 3 weeks of life. We'll finish off just thinking a little bit about appropriate disease testing and monitoring that can be possible at this time, and then also finish on the responsible use of antibiotics. So in terms of nutritional management, I'm not going to go into detail about managing the mid-gestation cow, but really we're looking for cows to be within that target range of 2.5 to 3 units at the time of calving. That's on a scale of 0 to 5. The reason for this is that there's a number of studies both in the UK and internationally that note that if cows are particularly thin, so under condition scored 2.5, particularly less than 2, or cows that are over conditioned, again over 3 or more 3.5 to 4, that these animals have problems calving, they have delayed fertility, and particularly with thin cows, we can see poor calf vigour. Now this work to get cows into an appropriate condition really needs to be done during the early part of the winter, and we need to try and get cows into that condition ideally by splitting them into separate groups based on thin, appropriately conditioned and overly conditioned animals. And what we don't want to be doing is trying to change body condition in the last month of pregnancy. In that last month, it's really important that we try to maintain cows on a level field of nutrition, and that we're not taking any action to try and either limit her access to feed or change her body condition in any way. So moving on to really thinking about that last month of gestation, we need to be focusing on meeting the cow's current needs. And as with all rations, we really are focusing on energy, protein and minerals. In terms of energy, that's going to depend on our cow, size, breed, type of animal you have. But as a ballpark figure, if we think of a cow at around 90 megajoules at the point of calving. In terms of protein, you'll see a number of different sets of advice out there. Most commonly, you'll see 9% crude protein of the total ration recommended. Up here in Edinburgh, we would consider that to be a minimum requirement. And I'll show you on the next slides why having restrictions in protein can potentially impact on calf health. Finally, in terms of minerals, you're looking to be feeding cows between 100 and 150 grams, depending on the brand you're using, of a dry cow mineral. And it's really important that this is specifically formulated for dry cows close to calving, because these minerals are higher in magnesium and lower in calcium. Using a general purpose beef mineral, or particularly a finishing mineral that would be higher in calcium and lower in magnesium, would not be right for these cows. And it's not uncommon to see cows with subclinical milk fever, potentially high levels of prolapses, if they're being provided with the wrong mineral. Once you've put together a ration that you feel meets that cow's needs on paper, the real focus and the main problem that we identify in suckler herds that we work with is around the intakes of that ration. And the intakes are absolutely key, because as that cow approaches calving, you've got a large calf, potentially twins that are taking up space in the abdomen. They're going to be pressing on the rumen and reducing the amount that that cow wants to eat. So to encourage maximum intakes in this last month, we need to ensure that the ration is fresh and palatable. Leaving a ration sitting in a back of a ring feeder for a week is not going to encourage these cows to eat as much as they potentially could do. We need to try and avoid group and ration changes, particularly in the last 3 weeks of gestation. Any disruption to that group dynamic or any change to the ration will impact on intakes and therefore on the energy and protein status of those cows. And then finally, whilst you may get away with some degree of overcrowding during mid-gestation, in that late gestation period, cows that are particularly tightly packed in, that are going to have trouble moving around the pen and accessing the feed, are going to have compromised intakes. So looking at an example ration that illustrates this point a little bit, this would be not an uncommon type of ration around where we are up in Edinburgh. A couple of kilos of reasonable quality grass silage at 25% dry matter and 13% protein, 5 kilos of whole crop, and then a couple of kilos of dark grains, with cows being allowed to eat straw ad lib. So that ration on paper looks reasonable, but when you actually adjust that for the cows eating to appetite, then this actually comes up to be limiting in terms of protein. It dips below that 9% minimum recommended. We do quite a lot of metabolic profiles up in Edinburgh. These are blood samples taken from commercial suckler units around 3 weeks off calving to see whether they're meeting their energy, protein and mineral requirements. Based on this information, we can then change the ration prior to calving so that we minimize any impact on calves. You can see in this particular ration, butyrate and NEFA are things we look at to look at energy, and only one of the cows here is coming up red. So the majority of cows are meeting their energy requirements, which isn't particularly surprising given the constituents of the ration. However, the urea in the cows, which is a measure of effective rumen degradable protein, that's AHDB or short-term protein, is marginal. So these cows are actually restricted for protein in late gestation. We've started receiving results in for this calving season already, and we can see a number of herds where they're restricted in protein coming up to calving. We'll talk a little bit later as to why that's important with respect to colostrum. So before we move on from feeding, it's just worth considering a few things. We would always recommend analysing forage. A good grass silage analysis like this, it's quite a dry grass silage, is going to be very different feeding to a grass silage that's coming in at 25% dry matter, for example, or a haylage or hay where the crude protein could be as poor as straw at 7 or 8%. We'd always recommend feeding any straights based on forage analysis. You may find that actually forages are particularly good and minimal or no straight feeding is required. So that's important in terms of the economics of feeding. And then it's always worth estimating the actual dry matter intakes of your cows. Again, how much they'll eat will depend on the size and type of animal, but you should be challenging your cows to be eating between 12 and 14 kilos of dry matter as they approach calving. We get asked a lot about minerals. I'm not here to recommend any particular manufacturer or brand. We generally prefer top dressed or minerals in a TMR when that's practical within a unit. It's not uncommon for us to see problems where buckets have been left down due to not all the animals in the group using those buckets. And then finally, you've seen one metabolic profile on the previous slide. Here's another one, and we can ask the cows what they think of their ration at 2 to 3 weeks off calving, and that allows us to determine whether what on paper those cows should be getting is really what they are getting. In this metabolic profile from this year, we can see that half the cows within the group have got an energy problem. These are 3 things we look at for energy status, and also they're severely restricted here for protein. In the previous slide, we were around 1.5, 1.6. Here, all of our cows are below 1. So moving on to ease of calving, this really comes down to one of 2 basic things. It's either going to be feeding or genetics. We've already talked a bit about correct body condition and the impact that might have on calf viability. We need to avoid overfeeding in mid-pregnancy, so I think it's pretty well accepted by most folk that if we're feeding cows too much in sort of months 5 and 6, then we're at risk of producing particularly large calves. But we've got to balance that against this requirement of not restricting feed during the last month of gestation. And that could be really tricky if the calving pattern is not compact. So if you have cows that are calving over 4 months all in one group, then it's going to be very difficult to ensure that those cows that are about to calve are actually fed appropriately, whilst those that are still 4 months away from calving are not being overfed. So it's a really good reason to either be sorting animals based on anticipated calving date or ensuring that you have as tight a calving window as possible. In terms of genetics, there are a couple of different EBVs to consider when choosing a bull. The first is the direct calving ease, and this is the function of both gestation length and birth weight, and it's how easy the calves of that bull will be born when that bull is used to serve 2-year-old pedigree heifers. A negative number on this EBV is bad. So for an example, a +6% bull versus a -2% bull, there's an 8% difference in the degree of assistance required. Now that would then translate through to 4% fewer heifers needing assistance, given that the bull is contributing half of the genetics. Secondly, there are maternal, also termed daughters or indirect calving ease EBVs, and these indicate the calving ease of the daughters of that bull. It's expressed in the same way, so it's the percent of 2-year-old heifers that require assistance, and a negative number is bad. In many instances, it's worth being conscious that this is inversely, so it goes in the opposite way to direct calving ease. Main reason that a lot of the maternal ease EBV is a function of the frame and size of the animal, and of course a larger animal is more likely to be a larger calf. So the art there is choosing bulls that ideally have good direct pardon me, and indirect calving ease EBVs. So I'm not going to go into a lot of detail as to when to assist the calving cow. This was covered really well in last year's webinar by AHDB, and there's a very good BRP manual on this available on the website. In general principles, most vets would advocate that it's best to leave cows to calve unaided. In terms of first stage, which is when they're uncomfortable, they may be nesting or restless, we'd recommend intervening if this phase lasts more than about 6 hours. In terms of the second stage, which is when they're pushing, you may see the water bag or some feet. It's recommended to intervene if those cows are straining for more than half an hour with no progress, or if they've stopped to rest and there's been no progress after an hour. So in terms of things that will impact on calf viability, it's well accepted that assisted calvings are going to result in calves that are less viable. Even though milk fever is not as common in beef animals, up until relatively recently, a significant proportion of the national beef herd would have a reasonable amount of dairy genetics in it. And subclinical milk fever in particular can result in prolonged calvings, which will therefore reduce the viability of calves. Across the world, iodine and selenium status have both been demonstrated to have direct effects on the calf's viability. And then finally, whilst I've not mentioned all the infectious diseases, to think about things like BVD, IBR, and the abortion-causing vaccines diseases such as leptospirosis and neospora are also going to impact on calf viability. And these are things that can be controlled at a herd level with proactive health planning with your vet. And if you are experiencing any problems with calf viability, it's well worth speaking to your vet sooner rather than later, as quite often more than one submission to the lab and multiple routes of investigation are needed to get to the bottom of the problem. And the sooner you flag it up, the better chance there is of actually getting to the bottom of it. So moving on to colostrum, we've got a live calf delivered. What's really the priority after it's born? So Most folk now will be comfortable with the fact that calves are born with no antibodies. The posh word for this is immunoglobulins, and they rely on these antibodies in the colostrum for protection against a whole range of diseases, from things like E. coli through to things like BVD and IBR. And that process of antibodies being transferred from the colostrum into the calf is called passive transfer. And the ability for the calf to take these antibodies up from the colostrum drops really, really quickly after birth. And when that transfer fails to happen, it's called failure of passive transfer, FPT for short. And that's been a major focus in the dairy sector over the past 10 to 15 years. We know a lot about it, and there's lots of steps that have been taken to try and improve passive transfer in dairy. We've been interested in this for the past couple of years, and I was looking back in the literature to really see when this first started becoming an issue that we were aware of. And this paper from 1975 is about as far back as I've managed to go, and that's pointed out that really little is known about suckled calf antibody status. And unfortunately, that's really very much the case today. Fortunately, there has been some work done in the US, and this has shown that calves that are affected by insufficient antibody levels in the blood are 1.5 to 2.5 times more likely to die or require treatment. So both the economic and the health and welfare implications are substantial when it comes to failure of passive transfer. So how common is it? There's no data for the UK that we're aware of. In Ireland, there are some studies suggesting it could be very high, up to 1 in 5 to 1 in 2 calves born. Numbers for Canada are a little lower, between 1 in 20 and 1 in 5 calves. All these studies have got very small sample sizes, and AHDB is currently funding work in England to really investigate this further to see, are we looking a bit more like Canada, a bit more like Ireland, or are we actually a bit better? So what sort of risk factors could lead to failure of passive transfer? What things do we need to think about? I sat down and wrote a list of things that looked plausible. The ones in red have been shown in multiple studies to be important. So an assisted calving, or if you're one of a twin, and then certain types of husbandry that you probably won't see in the UK are also associated with poor passive transfer. The ones in yellow on this slide have been shown in some studies, but not all. So feeding of the cow in particular with protein supply, and think back to the metabolic profiles I showed a minute ago showing restriction of protein to cows in late gestation. Whether you're born to a heifer or a cow, and I'll show you some data about heifers in a minute, and then calves that get very cold, or being a bull calf, although having said that, being a bull calf could well be associated with being an assisted calving. Things like breed, calf figure, cow behaviour and body condition, they're plausible, but they've not yet been demonstrated in studies. Part of the problem with that are the small numbers of animals in the studies. So you can see here we've got cows with different condition scores and very small numbers within these groups, and therefore there's no statistical difference between these animals. So there's quite a lot more work needed to really understand the risk factors. So thinking about calf figure, this graph is actually based on data collected from Holstein calves. It's very hard to find good data for beef calves, but it illustrates the point that really we want calves that are trying to stand up as soon after birth as possible. You know, there's a couple of calves here that are standing to birth, trying to stand the moment they're born, and then within half an hour, all the calves in this study are trying to stand. This really highlights the difference in vigour and how vigorous some calves are at the point of birth, and that some will take a bit longer to get going. At the other end of the spectrum, this is actually the number of calves that actually stood up and were standing and sucking. And you can see that in this study, we had 3 calves at sort of just over an hour that were up and sucking vigorously. By 5 hours, just over 3/4 of the calves. But by 6 hours, and this time's important when we're thinking about colostrum, it's still nearly 1 in 4 calves, potentially 1 in 5 calves, that are not actually up and sucking. Now, we could argue differences between breeds, but we'll all have seen the calf that takes an hour to stand up versus the calf that's on its feet within minutes of being born. So that's really relevant when we're starting to thinking about colostrum and delivery of colostrum. This has become the focus for the industry this year, with a major campaign focusing on the colostrum is gold, and stressing that getting the right amount of colostrum into calves quickly and good enough quality colostrum is absolutely essential to reducing disease and therefore the amount of antibiotic and the amount of treatment you're having to give to your calves. So what do we mean by quickly and quantity? We're talking about 3 litres, so 20 minutes of sucking as soon after birth as possible, and then another 3 litres at 6 hours old. Now, granted, we're not going to be able to measure how much a calf has sucked in most suckler systems. However, it's worth bearing in mind that previous slide where we're talking at 6 hours, where we've got a significant proportion of calves that are not standing. And therefore, calves that we can see that may have poor vigour, that are not up on their feet within an hour, that are not sucking vigorously within a couple of hours, are going to need assistance leading them to the teat or bottle feeding them to ensure that they've had sufficient colostrum for protection against disease. Don't get too much into this table, but it's just to illustrate the impact of being a heifer and ration on colostrum yield and antibody production. So this is the amount of colostrum produced by cows fed silage. We can see that cows fed straw are producing less colostrum, and heifers on silage are producing even less colostrum still. When that translates through to the amount of antibodies these animals are producing, we've got over 800 grams of antibodies produced by a cow on silage. That drops to just over 700 grams when she's fed straw. You can see the effect of diet and protein supply there, and then a heifer down at 400 grams. Now, I'm not here to recommend any particular colostrum replacer, but it's a question we often get asked as to which colostrum replacers are best or not. This work was done by a vet called Murray Cork down at the University of Cambridge, and he compared the amount of antibodies in the recommended amount to be fed of a number of different products. And you can see even the highest one, which was Immucol Platinum at 80 grams per sachet, was significantly less than this 400, 700, 800 grams that are being produced by the cows and the heifers. So the line is always to try and give calves a cow's colostrum wherever that is possible. Some of you might be storing colostrum. You might be getting colostrum from a nearby dairy farm. You can assess the quality of that using either a colostrometer, which is this piece of kit here, or a refractometer. These refractometers you can get off eBay from apple cider brewing companies. They're relatively inexpensive. And if you chat with your vet, you can talk through how these can be used to assess the quality of colostrum that you may want to store down. Always, always, always talk to your vet before using colostrum from another farm, because there are disease transmission considerations that you need to be aware of. So for the last few minutes, we'll move on to scours in calves during the first 3 weeks of life. So during this time, it's relatively predictable which bugs are going to be kicking around in the calves and which are responsible for diarrhea. And just to sort of flag these up to you, in the first week of life, most diarrhea cases will be something like E. coli. In the next 2 to 3 weeks, we're looking at the viruses, so rotavirus and coronavirus, and then also Cryptosporidium has become increasingly high profile over the past few years. This is a parasite. Down the bottom here, it's worth being aware that things like Salmonella and BVD can either cause diarrhea or be contributors to diarrhea in calves of potentially any age at all. So bearing in mind that a lot of these are not bacteria, so E. coli are bacteria, but these guys are not bacteria, then it will impact on the way you'll treat these calves. In terms of diagnosing scours, always speak with your vet, but be aware that samples can be sent to the lab, but there are now calf-side tests that are available. So there's an all-in-one test which allows you to take a bit of calf scour and look for the presence of E. coli, rotavirus, coronavirus, and crypto in these young calves. They're not always as accurate as a lab test, but they do provide a relatively inexpensive and rapid indication as to which of these bugs might well be causing diarrhea in your calves. In terms of treating, again, I'm not here to recommend any particular product, but if the calf is able to suck, then rehydrating them using electrolytes is the best course of action. Most of these products have got a good provision of both salts, so electrolytes, and then also glucose and amino acids to help support the gut. We'd not recommend withholding milk, The reason for this is that the gut cells actually rely on the nutrients in the milk for their healing. So if you withhold milk, whilst you might reduce the amount of diarrhea coming out the other end, you will be reducing the speed at which the gut will heal. And also going back to that previous slide where we saw that many of these are either a parasite or a virus cause to the diarrhea, antibiotics are often not appropriate. And if you're using antibiotics to treat diarrhea, it'd be worth catching up with your vet to see whether you've got a problem with E. coli and salmonella, or whether actually in these instances antibiotics are not necessary for these animals. If the calf is unable to suck or raise its head, then it's well worth calling your vet or taking your calf down to the vet to get some fluids in the vein. These calves can bounce back quite impressively once they're rehydrated and warmed up. In terms of preventing scours, we've talked about colostrum management and the importance there in terms of health. That can't be overstated. However, just as with feeding dry cows in the run up to calving, we talked a lot about intakes. The same for scours would be hygiene. And this really focuses on good quality, fresh bedding being put down as frequently as necessary. Ideally, ensuring that the calving period is as tight as possible. If you've got calves of a wide age range in the building, you're going to have more bugs contaminating that environment, and it's going to be harder to keep that environment clean. And then finally, biosecurity. You don't want to buy in salmonella. Salmonella outbreaks are incredibly stressful. They're quite unpleasant to have to deal with, and trying to keep out some of these nasties through good biosecurity is important. It's worth mentioning there are a number of vaccines on the market for the prevention of diarrhea in very young calves. They're used in both dairy and beef. By vaccinating the cow at least 3 weeks before calving, she will produce antibodies against E. coli, rotavirus, or coronavirus in her milk. That will therefore be transferred in colostrum to the calf. And then for some of these products, there's some evidence to show that that antibody production in the milk continues for a number of days and weeks after birth and continue to provide some local protection to the surface of the gut. These vaccines are not substitutes for hygiene. However, in herds where it's difficult to get on top of diarrhea problems with hygiene, these vaccines do have a role. They also underline the importance of getting a diagnosis. If there's a problem with salmonella or cryptosporidium on the unit, using one of these vaccines is not going to really help the situation at all. So just finishing off before we go to questions, thinking about what sort of disease testing and monitoring might be appropriate around the time of calving. In terms of checking up on passive transfer to see whether antibodies are being transferred from the cow to the calf effectively, this can be done by blood sampling 10 calves, depending on the size of the group, at around 2 days of age. It's relatively cheap at £4 to £5 a calf, and it can give you reassurance that the calves are getting the antibodies they should be. Alternatively, it's often used during a disease outbreak investigation to see whether actually poor passive transfer is part of the story of problems with calf health, especially in those calves under a couple of months old. Secondly, in terms of BVD, there's a big push in England now to sign up to BVD eradication programs. It's been statutory in Scotland now for a number of years. There's been good progress made with the vast majority of herds in Scotland that have reported significant improvements in calf health after eradicating BVD from their farms. And if the BVD status of the herd is known to be not negative, i.e. there's potential for disease to be in the herd, then calving is a convenient time at which you can try and screen the herd for it. Calf ear tissue samples can be taken at tagging. Those can be sent off for looking for BVD virus. And it's the best way of excluding a persistently infected calf from your calf crop. You can identify them, remove them from the crop so that this virus is not allowed to wreak havoc in your calf group. It dampens the immune system of the other animals in the group, and therefore having these animals running around is a real mechanism of asking for health problems. The other thing is it also allows you to infer the status of the cow from the calf test. So you essentially get 2 tests for the price of one. In this instance, you can rule out the cow being a PI if the calf is not a PI. So last slide, looking at the responsible use of antibiotics. The antibiotic-resistant bacteria becoming a major concern for the food-producing industry. There's a lot of public attention, government attention. The retailers are rightly asking questions as to how much antibiotics are being used in farming and what risks that potentially could pose to resistance in bacteria causing disease in humans. And for this reason, blanket group treatments are really no longer acceptable in farm animals. And thankfully, the beef industry is somewhat further ahead of many other sectors in terms of not applying group treatments across the board. However, there are pockets where practice results in quite high levels of antibiotic usage. We recently interviewed a small number of our clients and were surprised to see how many were injecting all their calves with antibiotics at birth, because that was felt to be the best way of addressing calf disease problems shortly after calving. So it's very important to make sure that the antibiotics you are using are covered by clear treatment protocols with your vet, so that we understand which infections are being treated and why, and that the most appropriate antibiotics being used. It's important to investigate disease problems to see whether something like BVD, failure of passive transfer, problems with calving and calf viability are related to the disease problems we're seeing. And really driving down use on farms where there is persistent high levels of use through good husbandry and biosecurity and health planning, eradication of BVD. Anecdotally, a number of herds around us have reported that their antibiotic use has reduced significantly since they've eradicated BVD. And then finally, through excellent colostrum management and ensuring that those calves have got the best start in life by getting the antibodies they need from the colostrum from their cows. So that's all the slides. So I'll hand over to the organisers and Catherine to see if there are any questions.
Brilliant, thanks Alex. Whilst I'm just waiting for a few more questions to come in, I'd just like to remind you all that the presentation has been recorded and will be available on the AHDB YouTube channels along with our other previous webinars, should you want to revisit it. We also, as Alex mentioned earlier, have our BRP Plus document on minimising calving difficulties available on our website, or email brp@ahdb.org.uk if you'd like us to send you a copy of that. So the first question, Alex, is how close to calving can you swap to a dry cow mineral from a general purpose, as the latter is much cheaper?
So we generally recommend 3 weeks before calving for any dietary changes, just because of the impact that could have on dry matter intake. So any change in the ration, we would ideally want to happen 3 weeks or before.
Okay, lovely. And what is the name of the calf side tests for Scours, and where might you get them from?
So there's a number out there. They are usually supplied through your vet. Sometimes some of the drugs companies will run a promotion, particularly for some of the vaccines, and they may subsidise some of those. So in the first instance, I'd ring your vets up and see if they're using them. If you're struggling to find some, by all means get your vets to drop me an email and we can put them in touch.
Okay, lovely. And then another comment is navel treatment still recommended for young calves?
Very good question. It's an area of interest for us. Yes, it would still be recommended. It's interesting looking at the evidence behind it because we don't have a lot of good evidence to support it. But yeah, we would still be recommending an iodine or chlorhexidine based navel dip for the navel.
Okay, lovely. And then just in reference to the first question, somebody's asked, what is the difference between dry cow and general purpose minerals?
Okay, so dry cow minerals will be formulated typically with high levels of magnesium and lower levels of calcium. So what they're aiming to do is to ensure that that cow is not at risk of subclinical milk fever, whereas a general purpose mineral would be the opposite way around. And then a finishing mineral would be particularly high in calcium so that they get bone development and growth during the growth phase.
Lovely. Somebody else has asked, would you still recommend antibiotic cover after assisted calvings, even if only having a quick examination?
No, we wouldn't. The real key there is good hygiene. So it's ensuring that you're wearing arm-length gloves, that you're cleaning up the back end of the cow, ideally again with a dilute disinfectant. We would typically recommend either Pevidine or chlorhexidine. So Hibby Scrub would be the commonest brand name for that purpose. So really it's about hygiene when you're doing the examination and during an assisted calving. If there's trauma or substantial damage, then that would be something to talk through with your vet in terms of antibiotic cover.
Okay. I don't know if you'll be able to answer this one specifically, but somebody's just asked, where can we get our forage analysed, please?
So there's quite a few companies out there. We often use Trow Nutrition, but just because we have quite a good working relationship with them. If you're buying compounded feeds from anybody, either for your sheep or for your cattle, then quite often they will subsidise the cost of getting that forage analysed for you.
Thank you. What is the difference with a pre-calving mineral? Is it very different to the dry cow mineral?
They should be the same, but double check with the manufacturer in case they're using slightly different terminology. So yeah, double check with the manufacturer.
Okay, thank you. And then another one, can you overfeed a calf with colostrum?
Good question. Never been asked that before. So yes, in terms of the volume that you're giving, that the size of the stomach is going to be limited. I gave 3 litres as sort of a clear message that we're trying to get out to the industry. The more nuanced message is 10% of body weight. So if you've got particularly small calves, then you might, that are sort of under 30 kilos, you might drop that a little bit. In the dairy sector, there are lots of calves that are being tube fed with around 4 to 4.5 litres. There's different views on that. Some of those calves are maybe a little bit too small for that. You see that they often lie down for a bit of time due to the discomfort from the distension of the stomach. So we try and stick to the 3 litre as a general guide for the industry. The more accurate number would be 10% of body weight. Okay.
What is the best brand of colostrum? I know there was a bit of advice on that slide, and it's a bit of a difficult one for you.
Yeah, so as I said in the webinar, I'm not going to recommend a particular brand. You'll be able to go back in the recording and look at the different amounts within those colostrums. I think the key thing there is really getting the message that cow's colostrum is by far the best. There's a lot more colostrum in it. There is one product that claims to have substantially higher colostrum levels made by a company called SCCL. However, we haven't seen any independent testing of that yet. So that's as far as I'm prepared to go on recommendations.
Okay, lovely, thank you. We have difficulty in balancing protein intake and keeping cows from getting too fat. Do you have any advice on that?
Yeah, so that can be quite a detailed question. It might be worth having a chat offline or with your nutritionist and vet. Essentially, it depends where you're getting your protein source from. So, if you're relying on something like beans, which are very high in ME, then it will be difficult to stop them getting too fat. In terms of that AHDB, so that short-term protein requirement, they tend to respond quite quickly to that. So some degree of restriction during mid-gestation when those cows are prone to getting too fat is probably excusable, but it's making sure that once they're 4 weeks off calving, that they do get the protein requirements that they need. And doing that up against the forage analysis should help to ensure that these cows are not getting sort of 130, 140 megajoules and therefore likely to get over-conditioned.
Okay, our cows have had a bolus for copper, cobalt, selenium and iodine. What other minerals should we be feeding?
So those ones are the sort of common ones you see in a bolus. They're going to cover a lot of the main things we're thinking about. The next ones really are your larger quantity minerals, so your macronutrient minerals, which would be things like calcium, magnesium and sodium. Those should be reasonably well balanced in most forages. However, that's the purpose of the dry cow mineral in terms of the calcium and magnesium status.
Okay, and I suppose sort of following on from that question, somebody else has asked, if cows have been blood tested and all is okay, do we need to feed any other minerals?
Yeah, another good question. So the one thing we can't blood test is calcium. The reason for that is very tightly controlled. The only time you get a really good measure of calcium is if you blood sample them at the point of calving, which is really very practical. So I suppose linked into that, yeah, most of the blood samples we do are looking at things like copper, selenium, cobalt, and magnesium, but things like calcium are very difficult to test for. So it is important to make sure that your ration's appropriately balanced for that.
Okay, and then a similar one on that, is there any way to get iodine into the diet other than a bolus? We are organic and cannot get hold of approved high iodine boluses.
There are. It's tricky to recommend them. So there are vets and nutritionists out there who are prepared to make up some custom iodine supplements that you can spread on to the surface of the ration.
Okay. What, in your experience, is topical iodine effective for sleepy calves?
So generally, when we identify an iodine problem, then where possible, we'd recommend bolusing. It's just a much more reliable and effective way of addressing it. So our preferred route of iodine supplementation would be through bolus. Bearing in mind the previous question we've had, that's not always going to be possible. I guess in terms of sleepy calves, you do have to have actually pinned it on iodine. So that does involve either blood sampling the cow herself, or if you do have stillborn calves or calves that die shortly after birth, making sure they're post-mortemed and that the thyroid gland is taken out, weighed and analysed appropriately to see whether iodine is part of it. So if the sleepy calf problem is related to iodine, then our preference would be to supplement them with a bolus.
Okay, lovely. Another iodine question, is it useful to pour on iodine for outwintered cows?
I guess that's similar to the previous question in terms of topical treatment. I'm aware that it's a practice that's relatively common. It's poured onto the back, and the idea is that they lick iodine off one another. Again, going back to our previous answer, it's very difficult to be assured that everyone's supplemented appropriately, and there are approved products out there, so those would be the ones we would recommend using.
Okay, what are best practices when freezing milk?
So I presume we're talking about freezing colostrum, and really it's labelling it with the cow it came from, so that you know where it's started life from, getting a date on that so you know how long it's been in the freezer for. Again, depends on the size of your freezer and what's in there, but getting it chilled in a fridge as quickly as possible, and then once it's chilled, straight into the freezer. What you don't want to be doing is leaving it lying around for 3 or 4 hours. The bacteria will divide in that pretty quickly, and therefore its quality won't be as good as if you'd got it chilled as quickly as possible and then frozen down once it's chilled.
Okay, what would cause a heavy breathing rate and a high temperature in a calf of 2 days old?
Quite a few things. So, the top of your list would be a bacterial infection of some type. High breathing rates can be due to obviously a respiratory infection, but there are other reasons why a calf might breathe particularly hard. So if it's what's called acidotic, so it's lost a lot of its bicarb and it's got too much acid in its bloodstream, that would make it breathe particularly hard. If it was septicemic, then that animal may have a high temperature and be breathing quite hard. So it's definitely the sort of animal you'd want to get examined. But a high temperature with a high breathing rate in a previously normal calf, you would be suspicious of a bacterial infection.
Yeah. We have traditionally given a multivitamin injection post-calving. Would you still advise that?
It's not something that we generally advise. It's unlikely to do any harm.
Okay. How long is frozen colostrum viable?
Good question. We typically talk between 6 and 12 months in terms of good practice, but there'll be folk that will be keeping colostrum longer than that and getting good results.
Okay. Would a high tick burden affect fertility? Slightly off topic, I suppose, but
yeah. So there are tick-borne diseases that can be affecting cow health and fertility. And if you think that ticks are part of the problem in your herd, it would be well worth going through that with your vets, looking at the sorts of diseases they might carry, potentially testing for some of those depending where you are in the country, and then taking any action necessary after that with your vet.
okay. What are your recommendations to achieve the balance of increasing the quality of feed intake to the cow and how this can affect scours to the calf?
So I presume we're really getting into nutritional scours in the calf, and we typically see that when cows are turned out onto very lush pasture and their milk yields go up very quickly. In terms of the run up to calving, the most important thing is making sure that colostrum quality is where it needs to be, and therefore ensuring that cow is getting at least that 9% minimum crude protein is absolutely essential to that. As those calves are getting a bit bigger, the cow's starting to come into milk and she's increasing her AHDB supplies, particularly if she's out of grass, then a little bit of nutritional scour is possible in the calves. But I'd be reluctant to try and actually restrict protein to address that. It rarely lasts particularly long, and if you're actually finding calves are particularly unwell with it, then I'd question whether it is just nutritional, whether there might be some other scour causing organisms contributing to that.
Okay. If a cow was suspected TB calf, is that calf at risk of contracting TB just from the colostrum, or does the value of mother's colostrum outweigh the risk?
Well, that's a tricky one. So, yes, colostrum can contain tuberculosis. We can see other abscesses. So, the outcome for that calf, if the cow's got colostrum, is questionable. So yeah, I think in that situation, it's not a question I've been asked before, mind you, but in that situation, trying to give it colostrum from another animal would be preferable.
Okay, thank you. What is the best procedure to store frozen colostrum?
I think we've covered most of that in terms of getting it chilled and frozen as quickly as possible. There are different vessels people use. Some people use rigid ones like ice cream containers. Others use expandable bags. You can actually buy specific colostrum freezing racks where you have a plastic bag that goes into the plastic rack. You fill it up with colostrum. Once it's frozen, you can take the rack off and then reuse that on the next lot, and you can stack them quite nicely in the freezer that way. But there's no need to buy something as fancy as that. As long as what you're using is clean, then that's appropriate.
Okay. If multiple calves are slow to stand but otherwise well, what would you be thinking? Would you be thinking it was genetics or dietary? What would your advice be?
Yeah, I think that's one that probably needs a little bit more investigation. So it would be worth thinking about whether that's just particular groups of animals, whether it's just heifers or cows, the calves, from heifers or cows, whether they're calves born to particularly long calvings at all. Yes, anecdotally, there's clearly a genetic component there. I'm not going to pick on any particular breeds, but many people talk about certain breeds having better vigour than others, so there will be a genetic component. And apart from genetics, I think the time that those cows have spent calving would potentially be impacting on the vigour of those calves. If it's across the board, in terms of all the animals are like that, then I'd be putting something like genetics higher on my list.
Okay, thank you. And then just one final question. Your recommendation of 10% of calf body weight for colostrum, is that in the first feed or in the first 24 hours of life?
Yeah, so that's, if you think of a 30 kilo calf, then that's 3 litres of colostrum. 10%.
Sorry, Alex. I think they were just asking, is that in their what's the time recommendation of when they should be consuming that?
Yeah, so 10% as soon after birth as possible, and then the same volume again after 6 hours.
Okay, lovely. Okay, thank you very much. Thank you to everybody for listening. We've had some great questions there and a really brilliant turnout tonight, and also a big thank you to Alex for presenting. We have a few upcoming webinars that you might be interested in also. At the end of February, we have one on grading for turnout, and at the beginning of March, we have one covering suckler cow fertility. So look out for those. They'll be on the website soon and available to register for. Thank you very much, everybody. Have a good evening.